A tracheostomy tube is an artificial airway which bypasses a person's upper airway. The tracheostomy tube is inserted directly into the trachea via a surgically created hole called a stoma. Tracheostomy tubes come in two varieties. One type of tracheostomy tube has a balloon-like feature at the distal end of the tracheostomy tube. This is called a cuffed tracheostomy tube. The other type of tracheostomy tube does not have a balloon-like feature. This is called a cuffless or uncuffed tracheostomy tube. A complication which may occur with tracheostomy tubes is the accumulation of granulation tissue in the trachea. When the tracheostomy tube irritates the airway, the body produces granulation tissue to protect the airway. When the airway develops a significant amount of granulation tissue, it starts to narrow the airway. This condition is called tracheal stenosis. Tracheostomy tube-associated tracheal stenosis occurs in about 2% of people with uncuffed tracheostomy tubes and up to 21% of people with cuffed tracheostomy tubes. Tracheal stenosis is a narrowing of the airway which can occur at or below the larynx. It can be acquired or congenital. Acquired tracheal stenosis is more common than congenital. For this video, I'll focus on acquired tracheal stenosis due to a tracheostomy tube. Acquired tracheal stenosis is most often caused by prolonged use of a tracheostomy tube. The risk of tracheal stenosis is higher as the length of time the tracheostomy tube is used increases. Tracheal stenosis most often occurs at the site of the tracheostomy tube cuff and at the stoma site. When the stenosis is at the stoma site, it is typically from abnormal wound healing with excess granulation tissue around the tracheal stoma site. Using a tracheostomy tube greater than a size 6 also increases the risk of tracheal stenosis. Properly managing the pressure of the tracheostomy tube cuff is crucial in preventing tracheal wall injury. Cuff pressure of greater than or equal to 30 centimeters of water were associated with greater rates of tracheal stenosis. Overinflation of the cuff on the tracheostomy tube can result in tracheal necrosis. Tracheal necrosis occurs when the blood supply is cut off to the tissue in the trachea. The tissue dies. This is called necrosis. This will eventually lead to tracheal stenosis. Cuff pressure should be around 20 to 30 centimeters of water. High volume, low pressure cuffs are also more likely to reduce the risk of tracheal wall injury. Other factors predisposing patients to tracheal stenosis include excess corticosteroid use, advanced age, being female, severe respiratory failure, acid reflux disease, obesity, autoimmune diseases, and obstructive sleep apnea. Symptoms of tracheal stenosis are closely related to the degree of narrowing. An individual may be asymptomatic in mild cases of tracheal stenosis. For more severe cases of tracheal stenosis, symptoms may include coughing, chest congestion, difficulty breathing, labored breathing, shortness of breath, fatigue, wheezing, and frequent respiratory infections. Since the symptoms of tracheal stenosis often mimic other respiratory conditions, the diagnosis of tracheal stenosis is often misdiagnosed or delayed. Diagnosis of tracheal stenosis is done by conducting tests such as chest X-ray, neck and chest CT scans, laryngoscopy of the larynx, and bronchoscopy of the trachea and lungs. Treatment of tracheal stenosis varies depending on the severity of the case. Often, endoscopic approaches may be performed. Repeat treatments may be needed. In severe cases, open surgery may be needed to reconstruct the trachea. Tracheal stenosis is not an absolute contraindication for speaking valves or capping use. A speaking valve is a one-way valve which works by allowing inspiration to occur through the tracheostomy tube and exhalation through the upper airway. In mild or moderate forms of tracheal stenosis, The individual may be able to exhale around the tracheostomy tube and through the upper airway without respiratory distress. If there is difficulty breathing or significant changes in vital signs with using a speaking valve or cap, then the device should be removed. A skilled clinician should assess the safety of using a speaking valve or cap. Tracheal stenosis is a serious complication which may require surgical treatment once severe. Tracheal stenosis may be a complication from prolonged use of a tracheostomy tube or cough overinflation. Practitioners should be aware of the symptoms of tracheal stenosis. Tracheal stenosis can be misdiagnosed as asthma or other pulmonary disorders, which will delay appropriate interventions. Thank you so much for joining me. Please remember to like and subscribe down below. I hope you have a great day and a wonderful week. Bye-bye!